face-to-face interactions will have to create revenue, as specialists can order tests, which they charge for, studies, which bring money in. But as a primary care provider, everything you do, nothing gets paid in general unless there is a face-to-face visit. And if there is no revenue, that means there is not going to be much sustainability for your practice. And if there's not sustainability, that means you would close and the patient would lose, you would lose, the healthcare system would lose. So having face-to-face interactions and different types of visit become paramount for the survival of the practice and for providing good care and for making care accessible to the patient. You're the gatekeeper and allow patients to have access to all the care they need. These visits give the opportunity to provide that care. The follow-up visits are the visits that are scheduled every 3 months or so, and they allow you to follow up on chronic issues, previous labs that you might have ordered, and follow up on compliance with the treatment plans. The acute visits are faster overall, and they address a specific issue the patient might be having. For example, if somebody has a sinus infection or upper respiratory tract infection or an allergy, reaction to a medication, these acute visits are very important because these occur mostly without planning. The patient develops a condition and needs to be seen. These visits help the patient save money instead of going to a walk-in clinic or to the emergency room. Coming to your practice for care, it's a very price than going to other facilities. The physical exams are the flagship of primary care visits. These are the opportunities to make sure that all the screenings are done, that the patients are current on vaccinations, uh, and, and it's a more complete visit. This visit, it takes longer than the other two we mentioned. The pre-ops basically is you assessing the patient and giving clearance for procedure. The goal is to make sure that the patient is safe to go through the procedure. And there is another type of visit called miscellaneous visits, which are, in my opinion, visit for issues that might not be an acute, might not be an emergency, but there are things that should be addressed face to face. So it's questions about letters or conditions or about medications, um, vital injections. So these are almost fall into the category of acute, but it's not an illness. It could be just a question. But it's better for you to have that visit than to do it over the phone, because over the phone you it's not the best care. The patient doesn't get all the questions answered as well, and you do not get paid for that. This specific PowerPoint will focus on chronic visit management. And you're going to notice that some of these slides do have voiceover, so you can look for the icon. And these are slides where I wanted to give you some insight and input. Other ones are self-explanatory, so all you need is just to review the slide. The follow-up templates are very long and they will have a lot of information. Some of it it's information that we put there so to have as much complete note and updated note as possible. It doesn't necessarily mean that you're going to be making inputs in those areas. For example, there's a big area on screenings. That's not something that we touch. We usually touch that when we're doing a full physical. So if you're doing a follow-up, I would recommend that you just focus on the basic components of of a chronic visit, which are the HPI, where it talks about medication and well, the past medical history would include past medical history and medications and allergies, and those things are automatically updated, but it's good to review them with the patient. But the HPI, basically, it's where the patient tells you what's happening right now um, with certain conditions. Then the labs update, it's something that we do just to make sure that we have the latest results available, the review systems, and the physical exam, and the assessment and plan. And at the beginning, um, it might be difficult to find where things are, but as you practice more and more, you realize that a big part of that template is really designed to be updated during the physical, not during the follow-up visits. Notice that on top of every visit, there is a part that says next visit. And basically, what that is a plan for the following visit. Because we move every previous visit towards the present visit. Whatever you put in that area will remind you what are the things that you did in last visit that you should be following up on this visit. And then after this visit is done, you update on what you will follow the following visit. So, for example, if you order an X-ray during this visit, next visit you will put to follow up on the outcome of that X-ray. The benefit of having something like this is that it helps you focus on what kind of issues you should be following up on. For example, if you order any test, you want to make sure that you review those results with the patient so that there's no abnormal finding that has not been addressed. Because after you order it, it's your responsibility to make sure that things are done. The other way we use this portion of the visit or the template is that, for example, if you refer the patient to a specialist, you would follow up and see if the patient went to the visit, what was the outcome of the visit.